Welcome back to an all-new episode of Caribbean Medical TV, where we journey through the islands to explore all things health and wellness. I am Dr. Mariam Abdul-Richards. Today we focus on a topic that affects so many of us: diabetes. Chances are that if you yourself don't have the disease, you know someone with it. But what do we really know about how diabetes affects the people of the Caribbean region? On today's show, we will once again dive in and take a closer look at the causes, symptoms, and the lifestyle choices that are inherently linked with diabetes. We will seek input from the top Caribbean doctors, professionals, and experts in this field. Join us as we explore this conversation further on Caribbean Medical TV.
We are living in the best of times and we are living in the worst of times. And I'm going to give you some good news and I'm going to give you some bad news, but let me start with the bad first. The burden of diabetes in this country is the heaviest it has ever been in our history. And whereas the common form of diabetes, type 2 diabetes, was a disease of older people, it's now emerged that it's very common in middle age and becoming increasingly common among our children. And you might wonder what's driving this process, what's driving this evolution, what's driving the change. It's a simple factor. We are gaining too much weight and we're gaining that weight earlier in our life. So the disease is being driven by overweight and obesity. That's the bad news. Unfortunately, it gets worse. It's not unique to us. It occurs up and down the region. Up and down the Caribbean region is a problem. Obesity is the forerunner, diabetes is a consequence, and heart disease is the successor. So they run one into another.
About 1 in every 8 Jamaicans has diabetes. And throughout the entire Caribbean, you'll find that same sort of number: 1 in every 10, 1 in every 8, 1 in every 7 persons will have diabetes. It also varies a little bit too, with even ethnicity. So like Indo-Trinidadians and Indo-Guyanese, they have a higher rate than, say, African origin persons. But regardless of that, it's just too high.
In Guyana, according to the Diabetes at Last, about 15% of the adult population in Guyana has diabetes. There are many more that is undetected, and that's due to lack of screening. Some people, they feel they're very healthy and they don't go very regular for checkups. So anyone who is experiencing frequent urination, frequent thirst, frequent hunger, dizziness, blurred vision, if they have a sore or ulcer that is taking a long time to heal, tiredness, listlessness, then it's always recommended to go to your professional healthcare provider and have them screen you for diabetes.
So like for the rest of the Caribbean, it is a major healthcare problem in Barbados. In the population of people over 25 years old, as many as 19% of the population had diabetes.
There's further bad news. The same factor that's driving diabetes and heart disease is also emerging as a driver of cancers. There are at least a dozen cancers that can be associated with being overweight or obese. And whereas heart disease and diabetes is the current epidemic, in a decade or two it's going to be cancers. So that's the bad news. But I want to tell you about some exciting and good news. Because obesity is the forerunner, if we could specifically target obesity, we prevent diabetes, we prevent heart disease, and we can prevent a dozen cancers. That's the good news. And over the last decade or two, we have learned a lot about prevention. You see, type 2 diabetes, the most common form of diabetes that exists in this and other populations of the world, goes through a long incubation period of many years. And therein lies the golden opportunity to not only to prevent diabetes, but to reverse it.
There has been a threefold increase in the number of people living with diabetes in the Americas in the last 30 years, and it is projected that the number of people living with the disease could rise to 109 million in 2040. Therefore, we as a Caribbean people need to take action.
The majority of people in the Caribbean would be in what we call a high-risk ethnic group. You know, blacks, East Indians predominantly. So we are at high risk of getting diabetes. We've come a long way in the past 100 years, from having nothing to having insulin to now having several modes of treating diabetes.
I tell my patients there's a difference between type 1 and type 2 diabetes. In type 1 diabetes, your body makes no insulin, zero, zilch. And therefore you need to take some insulin every day, otherwise you're going to die very quickly because of lack of insulin. Type 2 diabetes, they make some insulin, but not enough. But on top of that problem, their body's what we call insulin resistant. It doesn't respond to the insulin that it's making. So you're not making enough, and what you make doesn't work very well. That's the most common type. That's the one that we see rising at precipitous rates in the Caribbean. Not to mention a lot of the snacks that people love to have, all the sodas that people love to have, etc., fruit juices. All of that is digested and forms glucose. And when the glucose is in the bloodstream, the insulin is going to start to work on all of the cells of your body to absorb all of this glucose so it can be used for energy, so you can do whatever you need to do. Any excess glucose will be stored. Sometimes it's stored as a compound called glycogen, but many times it's also stored as fat, right? So the more carbs you eat, the more your body is able to store it, and it serves as fat.
The waistline is the predictor. Show me your waist and I'll tell you who you are. It's an important predictor of current health and future health. We must keep our waistline slim. It doesn't matter if we've got fat in our arms or in our thighs or in our butt. Our bellies have got to be extremely thin. I'll give you a little story about how important this instrument is in my practice. This was a traditionally good instrument. These are all good instruments, but this is the most important instrument in my practice. And I'll tell you why. So I can use this tape measure to measure waist circumference. I can measure my waist circumference, I can measure your waist circumference. And this is my waist circumference. And I come up at 78 centimeters, okay? So this is my waist circumference. I'm not being idly boastful, but for an Indian male, it has to be 80 or less. For an Indian male, it doesn't matter how old I am, this is the ideal waist circumference, okay? Now, interestingly, if I'm Chinese, I could be a little more. I could be about 84, 85. So the Chinese is allowed a little more girth. And if I'm African, I could go up to about 88. And if I'm a white, I can go easily to up about a 90 or 100. So your waist circumference has high predictive value for your own health. So that's why this instrument is important to me and why it's also important to you. And a simple measurement could be a feedback as to how much work you've got to do in keeping your waistline slim.
Insulin not only controls your sugar levels, it also helps to control the way how your body metabolizes or handles fat. And so insulin also will influence fat metabolism in the body. And therefore, persons who are diabetic don't have enough insulin to deal with the glucose load, the sugar load, but they may also not have enough insulin to also help to normalize their fat metabolism. And so fat levels rise in the body. Your doctor may notice this to say like your triglycerides, a particular form of fat, is high on your blood tests, or other types of fat. People might hear about good fat and bad fat. So the The good fat tends to be low and the bad fat tends to be high when your diabetes is not well controlled. And unfortunately, when the fat levels are also off, you start to get the complications of blockages, stroke, heart disease, poor circulation. And of course, when your sugar levels are high, that high levels that are damaging the organs and the blood vessels too leads to eye problems, kidney problems, nerve problems.
Such invaluable information. We will hear more from our doctors and specially invited guests after the break.
I can see clearly now the rain is
At Guardian Group, we've seen so many of our customers achieve great things. From key moments when together we've planned for the future to those unforgettable days when you've celebrated the rewards of those great decisions. So, it's no surprise that after 175 years, our optimism is stronger than ever. Because when you've partnered with people to achieve their best lives as long as we have, you tend to see the world a little brighter every day. Guardian Group. Live easy.
You're watching Caribbean Medical. I am a diabetologist and a wound care specialist by profession. The person with diabetes or uncontrolled blood glucose, they develop peripheral artery disease and peripheral neuropathy. When we focus more on the diabetic foot, all right, we look for those two complications. So peripheral artery disease with uncontrolled diabetes, there is damage to the vessels. It's generalized, but it's more profound. You will have damage to the vessels in the leg and the feet. And due to that, you will have damage to the nerve.
You might find people are unable to feel the bottom of their feet, and they're unable to, walk on something and feel when they get a nail prick, or something like that. And then that in turn can then lead to a whole cascade of infection, and that is what then eventually leads to amputation.
Once the patient comes to the office and the patient have an ulcer, all right, what happens is that you will have to assess the patient and you will holistically manage the patient. In cases where there is severe peripheral artery disease, and if no vascular intervention can be done, then we classify the wound as a maintenance wound. So you keep it clean, you keep it dry, you keep it without infection, and they will have to live with that until it reached a point where they have an amputation.
Right now, about 40% of the increase in diabetes is due to longevity. We're living longer than our parents and our grandparents. And about another 40% is because of obesity. And then another 20% is because we're getting older and obese, the interaction together. So it's a lot. But diabetes now is so prevalent that if we're not careful, we might be one of the last generations to live longer than our parents and grandparents because it's shortening our lifespan.
The early genesis of diabetes and obesity may reside in the womb. And what occurs in the womb doesn't stay in the womb. It's not like Las Vegas. We now know that if a mom develops diabetes during a pregnancy, so-called gestational diabetes, the high sugars that the baby is exposed in utero prints and imprints and programs diabetes and cardiovascular disease in later life. And in fact, that's why gestational diabetes screening is essential, because 6 of our 10 women folk is already overweight or obese by the time they're 20 years of age. By the time we reach reproductive age, many of our women folk are already carrying a heavy burden of abdominal obesity, which is the forerunner to diabetes.
I am what you call a juvenile diabetic. My mom had gestational diabetes when she had me. I have inherited diabetes at birth. So at a point in time, I was probably a really obese child. I would have shown signs and symptoms such as, for example, getting a rash that never healed, going to a doctor, and then he's giving me medication to heal the rash, but it's not going. And then on another visit, he did what we call the urine test. It showed 4 pluses in the urine, which was pretty high for a kid. So at that point in time, that is when I initially discovered I have diabetes. I am living proof of diabetes at a tender age of 5 years old. I grew up with fast food initially, which would have led to where I am today. You name it, I had it. So basically, for 36 years, I've been fed unhealthy.
When thinking about eating and meal planning for diabetic, or I would say even for someone who is pre-diabetic, there are 3 things I feel is important to think about. One is what? So quality, I like to say, thinking about the quality of your food choices. 2 is quantity, so how much? And 3 is timing, how you space it out throughout the day. So quality, choosing the highest quality of foods. The simple way you can think about this is the closer to nature, the better. So we're talking about whole foods, foods that have not been highly processed, and in the Caribbean we have a large variety of these. So this includes your provisions, right? All your ground provisions, even the sweet potato, they come with fiber. So these are high fiber foods, and they come along with vitamins and minerals. So the fiber, the vitamins and minerals help your body to be able to process the carbs and the sugar a lot better. So you don't get a spike in your blood sugar.
One of the things that we do or should think about is eating a little less. I tell people it's nice to have a 20% reduction in your calories. That's a fifth. And what does that mean? If you're going to take 5 scoops of rice, you take 4, right? Just take a little bit less. So even if it's not the healthiest plate of food, at least taking a little bit less will help you in weight stabilization and maybe even a little bit of weight loss.
Stay tuned for more on adopting a healthy lifestyle to prevent diabetic complications here on Caribbean Medical TV.
In our organization, we engage quite a bit in what we call CSR, or Power to Make a Difference program, and our Power to Make a Difference program actually touches on quite a bit as well of what the sustainability and the equity goals aligned to these principles of responsible banking are all about. But it's so much more. As we go forward at a group level, it is our intention to spread this out, to let Republic Bank maybe be the cheerleader for this initiative in the Caribbean.
Let's join dietitian Mawea Elias alongside chef Ian Rooks for a healthy recipe for anyone striving to lower their blood sugar.
You've heard me discuss some recommendations for good blood sugar control. I'm here with Chef Ian Rooks, and I think the last time we saw you, Ian, you were picking kale.
Yes, thank you, Maria, for the welcome.
Yeah.
Unfortunately, today I didn't get any kale, but I have got a wonderful array of fruit and vegetables that are good for us that are diabetic. I am type 2 diabetes, recently diagnosed. So whatever Maria has to say, I am listening, and so should you.
So we spoke about menu recommendations for someone who is diabetic, or for anyone who really is trying to control their blood sugar, is pre-diabetic. So we're just going to discuss some of the options. We can start with breakfast. Smoothies are a delicious way to have a quick, healthy, balanced breakfast. So we are using yogurt because that's going to be a good source of protein.
This is Greek yogurt.
Greek yogurt, plain. You want to start off with a plain because we're going to add fruits to these smoothies. So we don't need the yogurt itself to be sweet.
How much should I put?
So if it's 1 serving, about half cup. So this is going to make it more balanced. So now fruit. What fruits are we going to use?
I would have automatically gone for the banana.
Yes, most of us use banana, but banana, did you know, has the most sugar, ripe banana.
I actually just found that out. It gives a spike, a sugar spike.
Of all the fruits. So if you are going to use banana, because it does thicken the smoothie, you're using half of that banana would be 1 serving. If you want to choose a second fruit, I would recommend you choose a lower sugar fruit. So we have here some blueberries. Berries, of course, have the lowest sugar of most of the fruits. So they complement our tropical fruits really well.
Well, that's another thing, because sometimes we can get them and sometimes we can't. You go to 5 different supermarkets, there's not a single fresh blueberry. Can we use the frozen blueberries?
The frozen blueberries, I think, are actually better for our region, because when you think about how far the berries have to travel from what state they come from, we tend to get a lot of moldy berries. So the frozen berries have more nutritional value than the fresh berries because of the length of time it takes.
There you have
to
it,
get
folks,
to
because
us.
you know that the frozen blueberries are readily available in many different outlets of supermarkets.
Yes. So we can add our blueberries.
Okay, go right ahead.
Excellent. We have our fruits, we have our yogurt. Now we're going to add in our green. You want to add something green because we're always trying to find ways to get more vegetables in. So if it's for 1 serving, I'm not going to do the full cup. I'm just going to do about half cup, but the sweetness from the fruit and the yogurt will generally cover up the taste.
So I'm going to make this a little more liquid.
Okay.
What about if I just add ice?
You could add ice, you could add water.
Maybe milk?
You could use milk. I mean, you do already have the dairy from the yogurt, but you could use milk.
What about if I used almond milk?
Almond milk would be fine if that's your preference.
Unsweetened.
Unsweetened, yes. Unsweetened.
I'm learning quickly.
Yes. Cinnamon.
That is a friend of diabetes.
Yes, yes. And so whenever you do have the opportunity to add cinnamon in, now it's strong, so you just need a little bit. And that is going to help our bodies to process the sugar that's in the fruit a little bit better. So a little bit of cinnamon really does help the blood sugar to not go as high.
Okay, so we're going to blend it up now, and then you and I are going to have a little taste. How's that?
Can't wait. And one tip would be that if you are using the greens and you want them to get really blended, you might want to blend those first with a little liquid and then add the ice or heavier ingredients.
There we go. Cheers.
Oh, I like the cinnamon. I get that cinnamon. I don't taste the spinach, which is good.
I'm tasting the banana, and I love Greek yogurt, so I think we have a winner here.
Yes, thank you. Cheers to good health.
To everyone, and to us.
Thank you, Ian and Moea, for showing us how to control our health with a healthier diet. Diabetes is the 4th leading cause of death in North America and the Caribbean. Therefore, the choices that we make can be the most important factors in predicting our future with diabetes.
There have been studies that have shown that it is possible by lifestyle measures to prevent diabetes. So people who are at risk of diabetes, they've been studied, and the ability to lose just as little as 5 to 7% of the body weight reduces the progression to diabetes.
This epidemic relies on obesity. So unless we target obesity at the population level, it's going to be a never-ending spiral. So we've got to get the lifestyle factors right. We can today achieve that with proper nutrition, proper physical activity, and with the drugs available to us. In our culture, we are drug averse. That's the problem. We do not believe in the principles of prevention. We prefer to wait till the horse is already bolted and then try to lock the gates. And unfortunately, it's all too common a problem. I think I'd like to emphasize the need to prevent disease rather than to try to reverse them.
Prevention is crucial. Take responsibility to protect yourself. Screening is an important step in preventing diabetes and even living with the disease, so you can be there for your family in the years to come. Know your numbers.
We can measure our blood sugars in a number of ways. Finger pricks, we can do continuous glucose monitoring, and in the lab I can get an assessment of my 3-month measure of control as a term test.
Regular exercise is an important tool to help prevent diabetes or to maintain health in diabetics. With so many options for cardiovascular activity, all can find exercises that suit us and, most importantly, keep at it.
So we are very fortunate to be able to offer hydro riding to persons who may need knee or hip or ankle mobility, or if you just want to have a different way to improve your cardiovascular benefit and or the strength benefit. You don't overheat because you have the cooling effect of the water, and because of the hydrostatic pressure of the water, the venous return improves your circulation. Together alongside with the hydro riding program, we offer our aerobic fitness, which doesn't include the bike, but utilizes many different types of equipment in the water, such as rubberized resistance equipment. And you're thinking, rubberized resistance? Yes. In the water, you're not just working on cardiovascular benefit, but you're working on strength as well.
As we turn 30, every year we lose more and more and more muscle. Muscle is the only way for us to somehow influence our metabolism. Muscle is important because the more muscle you have, the more calories you burn at rest. Okay, muscle is a very expensive item to maintain, so our body works really hard to maintain that and burns more calories. You become more insulin sensitive. You can control your blood sugar better when you have more muscle.
As we strive to improve the health of our region, we must remember that while once diabetes could be a tragic diagnosis, we now have the means to prevent it and to manage it. We can take responsibility, work together, and reverse the course of diabetes in our communities.
Many thanks to all our doctors and special guests. As we said earlier, chances are you or someone you know has diabetes. And we as a people have to make a united effort and make a difference. We all have a part to play as diabetes has an impact on all of our lives. Working together, we can increase awareness and improve the health of our population. We can be proactive and focus on the importance of diet and exercise while also talking to your physician if you believe you are at risk. I am Dr. Mariam Abdul Richards. Remember, where there is support, there is hope.
When persons come and they tell me, oh, I feel like dying, I'll ask, do you genuinely want to die? Or if this could be fixed, would you be okay with being alive? And most of them will say, well, if I didn't feel like this, I'd be happy to be alive. And so if we could have taken care of all of that before it got to that point where they feel like I really cannot handle this anymore, then so many more suicides could be prevented.
We live, yes, in the Caribbean. We have a lot of things going for us, but we also have a lot of stressors. And when we think in terms of the economic situation, we think of the environmental changes. There are so many things going on a day-to-day basis. So coming to a psychologist basically is a preventative measure that you want to come and just chat.